All right. Good evening. Good evening, everyone. Tonight, the topic is saving your life with wearable technology. You'll see if you look in the bottom left-hand corner, this was an APCUG presentation given in November of last year. So it's available online, so you can watch this again. So you won't need to keep notes. I'm also taping this for you as well, so you'll have this as a recording. Now, the goal of this presentation, I like to keep my presentation simple. The goal of the presentation is to teach you two things. First of all, to teach you two common medical conditions that can lead to incapacitation or stroke, and also how wearable technology can help you identify these conditions and seek medical help. Now, a disclaimer for the presentation. These are not the views of any organization. They're not meant to be any personal medical advice. You should always check with your healthcare provider before you change any treatment plan. And the people in this presentation are fictitious and do not portray any member of our community. So that should be the legal stuff, and that should keep me out of hot water. Although I understand there's two doctors here as well, so I'm going to have to be very honest tonight with it, or I'm going to get caught. Now, I will tell you that I've given this presentation to many different clubs. I don't expect you to read this, but it did save a life. I gave this presentation to a club. One of the individuals followed through with my recommendations. That sent him to the hospital a few days later. He was admitted. The cardiologist said if he hadn't come in, he would have died that night. So he wrote me a very passionate letter saying, thank you so much for saving my life. And also the resort sent me a nice letter as well. So this presentation has saved lives. So I'm very proud of the presentation. Now, most of you may or may not be aware, but wearable medical devices are a huge business. If you go to Best Buy and you look in Best Buy, you will see wearable devices are a big part of Best Buy's floor space. And the spending on wearables by 2026 should be around $66 billion. Now, if you actually look at the, if you actually look here, you'll see that the smartwatch, which we're going to talk a lot about today, is about 17.6% of the wearable technology. The earwear is even higher at 40.7. Now, there's big amounts of money to be made in this. In that Apple this year, which has a sizable chunk of the market, sold in the last quarter of this year, or last year, sold 29.5 million watches, which was a 200% increase at the same time the previous year, and they control about 35% of the market share. So it is big business. Let's see if I can get this slide turned here. There we go. Now, the three leading the three leading companies in the wearable market are Apple, Samsung, and Fitbit. Apple is clearly the leader, and they're probably about 2 years or 3 years ahead of most of the competition. Coming up second to Apple is, of course, Samsung. And the third is Fitbit, which is interesting because Fitbit has struggled in the past, but of course, you may or may not remember, but a little company by the name of Google bought Fitbit last year for $2.1 billion. And we're going to be talking a little bit about that because you are going, and well, you will already see big changes in how Fitbit is being managed and what's going to happen with Fitbit. So these are the three. We've got Apple, the leader. We've got Samsung coming up in the rear. And the one that's going to probably be a major player is going to be Fitbit, which is now owned by Google. Now, we're going to be talking a lot about a company called AliveCor. AliveCor is a US company who actually developed a lot of the technology we're going to talk about. In fact, they sold some of their patents to Apple, and they are big. They're really big in this market. And AliveCor's, this is Dr. Sherbati was just hired by Google from AliveCor to run their whole division. So this is going to be very interesting. And you've already, we'll talk about that in a minute. And you'll see the big changes that have already occurred. Now, we're going to talk, as you probably are aware, some of the health tracking features or cardiac tracking features of the Apple Watch, but who knew? These are all the Fitbit watches here that are all available. And if you look down here, you'll see all the different models of the Fitbit watch. Those of you who have Fitbits understand that there are a lot of different makes and models. Now, one of the problems with Fitbit was they really didn't have enough capital to get into the healthcare race that Samsung and Apple are doing. But with Google purchasing them, they've been able to get quickly into the market. In fact, Dr. Sherbati was able to reprogram the software in all these watches to come up with an atrial fibrillation study. And we'll talk a little bit about that in a minute. But this is called the Fitbit.com. It's the heart study. I'm not sure if this is the link that you can use to participate in the study. I'm not sure if the trial is closed now, but this is a trial that is in the United States now. And those people who have all those models of Fitbit can participate in this study. And that is to try and identify people who have a common condition called atrial fibrillation that we'll be talking about. And so if you do have a Fitbit, then this might be fun to participate in. Now the Apple heart study, which was another big study that was just the second one that's being done. They recruited over 420,000 participants. I had made a lot of good friends because when I gave this presentation, Apple was still looking for participants, and if you signed up, you got an Apple Watch Series 5. So I got a lot of people free watches, but that study now is closed and it's moving ahead. So I wanted to talk a little bit about Mary, and I want you to think about Mary because Mary could be you. And of course, Mary is a fictitious person, but it could be you. And we're going to talk about Mary and her life. Now, Mary is 70.
Listening to the LACS program tonight, right now. It's on medicine.
Let's just mute everybody again. All right. So Mary is 74 years old, and she is widowed, lives full-time at Silver Ridge Resort, which is actually the resort where I live in the winter. Now, Mary has lived at Silver Ridge for 7 years and has won the hearts of all the residents. She lives by herself in a park model with an Arizona room, which has a very good friend across the street who she walks with every morning at 9 a.m. Alice and Mary walk around the Silver Ridge perimeter and then have a cup of tea. And you'll see Alice down at the right here and Mary's up to the left. Mary's very active and is a member of the pickleball club. And her highlight of the year is Monday morning meetings at our computer club. Now, of course, I had to put that in, right? And Mary has been widowed for 12 years. Her daughter, Meg, is an accountant and lives in Palms Desert and comes to visit Mary once a month. Now, Mary has pretty good computer skills and she Skypes with Meg. Mary doesn't drive anymore and uses Uber for transportation. Now, Mary's health. Mary likes Mary's health. She sees Dr. Jones. Dr. Jones has been her family doctor for the past 12 years. Mary sees him twice a year at his office. Mary's a little overweight and she's on a mild blood pressure pill. He recently saw her and found that her blood pressure and pulse were fine. Mary told Dr. Jones that her daily walks with Alice would try to get some extra, and she would try and get an extra game of pickleball in. Now, we have a mail room at Silveridge, and so what happened was Mary went to get the mail, and on her way back from the mail room, she felt a little bit lightheaded. And this is sort of the route back from the mail room, and she felt just a little bit lightheaded, and she sat down in the grass to feel, and she's just a little bit dizzy, a little bit lightheaded, didn't last very long, and she felt much better when she sat down. Now John came by in his golf cart and took her home because he was concerned about her. And her symptoms all went away, but John called her later on and she said, of course, she had talked to Meg and she got an appointment with her Dr. Jones the next day and he was going to see her. Now, of course, you know this is a made-up story because who gets an appointment with their doctor the next day, right? That's not usually going to happen. But anyway, so the story goes, she goes to see him the next day. Now, so she had this brief dizzy spell. Now, how many of you have had a little lightheaded, a bit of a dizzy spell, you just didn't feel very well, just for a very brief time? So she sees Dr. Jones and she goes in and she tells him what happened, and he examined her and he finds that her blood pressure is fine, her pulse is fine, couldn't find anything wrong with her. So he said to her, you know, Mary, this is just happened this once, let's just wait and see if it happens again. And I think that's probably a reasonable decision. And so he let her go home. So about 2 weeks later, Mary was cooking supper and felt a similar lightheadedness. She felt a little bit dizzy again. She had no chest pain, no palpitations. And so she sat down in her lazy boy chair. Again, she thought she'd better go see Dr. Jones. So she went to see Dr. Jones the next day. And Dr. Jones said, well, you know, I can't find anything wrong. Everything's fine. He even did an ECG, and he couldn't find anything wrong with her. So he said, well, you know, we're going to do some tests anyway. I think we should do some tests. So he set her up for some tests, and she said, well, let's do those next week because Meg's coming for dinner on Friday. Now, the next day, Wednesday morning, Mary got up to have a pee about 2:30 in the morning. And while getting off the toilet, she got another attack. And she fell to the floor because she lost consciousness, and she heard a crack in her right hip. And she was in terrible pain, and she was wedged between the toilet and the shower. She couldn't move and called for help, but of course, she lives in a resort. This is July, no one's there. There's only 50 people out of 700 homes in the resort in the summer. Well, Alice found Mary at 9 a.m. the next day, and when the ambulance arrived, Mary was very cold, her blood pressure was low, and her pulse was 46. So her pulse was very slow. So on arrival to Banner Hospital, she had a temporary pacemaker inserted. She was transferred to the intensive care unit where she was stabilized, and she had a permanent pacemaker. Her hip was repaired, and to the delight of everyone, Mary had an uneventful recovery. She's back doing her daily walks with Alice, but has given up pickleball. Now, we're going to talk about Mary and some of the things that went wrong here and how we could help her. So let's look at this now. Obviously, Mary had a heart problem, and there are a number of heart problems that you can have. And we're not going to talk about any of these. In the bottom right here, you'll see this is called coronary artery disease. This is where the arteries to your heart get plugged up. And sometimes you need surgery to clean out these arteries. Sometimes you have to take cholesterol medicine and stuff like that. But we're not going to talk about this. Sometimes this is your heart here. On the left-hand side, these are the valves. You see the heart pumping away. Your heart actually has 4 valves. And sometimes you need a valve job, just like a car. Your valves wear out, but that's not what the problem was here. And sometimes you get an infection in the heart muscle. This actually is a COVID-19 thing. That's probably the most common cause now, and you actually get an infection in the heart muscle. And again, we're not going to talk about that. These 3 conditions were not what Mary had. But what we are going to talk about is the electrical conduction of the heart. Now, it's an electrical problem. Now, I know because I talked to all of you earlier today, and I know you're all very smart. We even have 2 doctors that are here tonight too, so they'll be able to fill you in and help you with this as well. So because you're so smart, I know that you're going to get this in 30 seconds. Normally medical students take about a year to figure this out, but you're going to get it in 30 seconds. If you look to the right here, you'll see this is a circuit breaker, right? And you probably recognize this as a circuit breaker in your house. Look at the right side. Now, when you turn the circuit breaker on, the lights go on, right? And when you turn the circuit breaker off, the lights go off. So that's how simple it is. Your heart actually has 2 circuit breakers, but we're only going to talk about circuit breaker number 1, which sits right here. Now, this is the main feed in from coming electrical feed coming into your heart, and it goes to pacemaker number 1. Now, guess what happens if you turn this off, your heart stops. Pretty simple, right? That's a bad thing. If it gets stuck in the on position, it goes too fast, and that can be called atrial fibrillation. So we either have it on or off. Very simple. That's all you have to know. The whole talk today, if the circuit breaker is on and it's too much, then you get atrial fibrillation. If it's off, then your heart stops, which is a bad thing. So that's all you need to know about the reason. So one of the things that we would like you to do is we would like you to know if your pulse is too slow or if your pulse is too fast. Now, you could certainly measure your pulse, but that's sometimes difficult, and we have lots of devices that do that. If you look over here to the right, you'll see this. This is a some activity tracker, and you'll see that there's a number on here that says 148, which would indicate the pulse. And again, this couple all have their watches on, and they're watching their pulse, and they can find out, is their heart beating too slow or is your heart beating too fast? And we need to know that, and we'll talk about why that is so in just a minute. So we need for sure to monitor your pulse. Please do that. And again, you'll see here, if you look up in the top left, you can certainly take your pulse, but sometimes it's much easier for these activity devices, which you can wear around your wrist. And on the left hand, you have the Apple Watch, and on the right side here, and on the right side, you have some of the other ones. So they all do this. So when you buy an activity tracker, some activity device, it will all measure your pulse. Now, I'm going to talk about why this is important. And again, all activity trackers measure your pulse, but the value for seniors is really monitoring your pulse. We're not going to talk about the accelerometer for falls and emergency contact. That's in part 2, and emergency notification as well will be in part 2. But we're going to talk mostly today about your pulse. So what happens if your heart beats too slow? Suppose this pacemaker number 1 here, suppose it fails in the off position. Well, your heart is going to slow down, and it's going to get very, very, very slow. And that's certainly a bad thing if it gets too slow, because you're going to get into problems. And we're going to talk a little bit about that in a minute. So that's pacemaker number 1 if it's too slow. Now, this is a list. I want to look at the incidence of pacemaker insertion by age, okay? And so if you look here, you'll see obviously this is an age group here, but you will see that age 60 is when you will likely, the incidence of requiring a pacemaker because your heartbeat is too slow goes up exponentially. And if you look here at this line, you will see your chances of requiring a pacemaker by the time you are 80 or above is extremely high. And that's because just like your arthritis in your knees, it's like the cataracts that you've had, it's like the other medical problems, you will find that your heart, particularly the electrical, that pacemaker number 1 wears out. And so the chances of you requiring that, and this is what happened to Mary. She had a couple of episodes, and the other problem is that when this is an electric problem, if you have had your car and you've had an electrical problem in your car, you know how difficult it is to find. And that's why Mary had these episodes, and she went to the doctor and they couldn't find the problem because it's intermittent. Had Mary been wearing a device that measured her pulse, then she would have, if she'd gone to Dr. Jones and said, gee, you know, when I felt that dizziness, I looked down and my pulse was 40, Dr. Jones would have made the diagnosis right away. So that is why it's so important that you monitor your pulse. And we're going to talk a little bit about that as we move on. Now, the Apple Watch, which you, of course, will tell you right away if your heartbeat is too slow. In fact, it will come and it will, right on the watch dial, it will tell you if it is too slow. If your heart is too fast, if pacemaker number 1 gets stuck in the open position, then your heart will beat too fast. And this can lead to what we call atrial fibrillation. And this is when your heart speeds up. And again, it is the same problem. It's the same circuit breaker number 1 is a problem. Now, the problem with atrial fibrillation is that it causes stroke, and it's a leading cause of stroke. Now, that's one thing that you do not want to have, because when I make rounds at the hospital and people, I stand around the bed and they say, why did the family's all looking at me and saying, why did Dad have this big stroke? And I say, well, he has undiagnosed atrial fibrillation. So atrial fibrillation needs to be caught early and it needs to be treated. But guess what? Guess what? Age 60, look at the incidence of atrial fibrillation. It goes up exponentially with age. So by the time you reach 80, there's a very good chance that you're going to have atrial fibrillation. So how do we diagnose atrial fibrillation? Well, guess what the Apple Watch does? The Apple Watch actually will tell you if you have atrial fibrillation. It will come up and it will actually say right on the watch dial, you have atrial fibrillation. Now, early on, 2 years ago, there was a big study with the Stanford Medical Center. Apple did this is the first study they did. This was the Apple Heart Study, and they did a big study to track people with atrial fibrillation, and they found that indeed the Apple Watch does an excellent job in diagnosing atrial fibrillation. Now, I want to talk a little bit about an ECG and what an ECG is. If you look up on the right-hand side here of the monitor, you'll see this very ancient machine. And if you look at the date here, if you look at the date, you'll see the date is 1860. Now, folks, in 1860, they were still burning witches at the stake. So this poor fella went into his doctor and found was having some problems, and the doctor sent him over to have an ECG. I'm surprised that the doctor didn't get burned at the stake. Can you imagine? Look at the this is the very first ECG in Germany that was ever built. Can you imagine? He's got his hands in both buckets of water and his foot in a bucket of water. He's connected to this really weird looking machine, and they're doing some sort of test on him. So I'm not sure why the doctor didn't get burned at the stake for heresy. But anyway, the point that I'm making, from very early on, we were able to figure out that electrical things in the heart could give us some very valuable information. And if you go over to the left here, you will see this is, many of you have probably been to the hospital and you've had an ECG, and this is sort of, you get all these sticky things on you, and then of course and of course it gives a piece of paper out like you'll see here, and this is an ECG, and this is really what we go to medical school for a long period of time, because we want to look at this and try and figure out what the heck this means. Now, the interesting thing about this little piece of paper, we can tell about how your heart has behaved in the past. We can tell if your heart had, if you've had high blood pressure for a long period of time and haven't taken your medication. We can see that in this piece of paper. We can talk about the present things. We can also see exactly if you come into the emergency department and you have chest pain, we want to know if you're having a heart attack. We can look at this piece of paper and we can also tell, in fact, if you're having a heart attack. And we can tell the future. We can tell how your heart's going to behave in the future. So this little piece of paper that we do, that they diagnosed in 1860, we can tell the past, present, and future of your heart by doing this. So that's what an ECG is. Now, you'll never guess what. The Apple Watch does an ECG. Yes, indeed it does. The Apple Watch is paired with your, now you have to use an iPhone with the watch. You can't just buy the watch. You have to actually use the watch with the phone. But if you look up at the right here, you'll see if you touch the crown, if you touch the crown right here, and you will see that it will record an ECG. This is the ECG that it records down in the bottom right, and it's stored on the phone as a PDF file. So it's stored on the phone. Now, why is this so important? Well, because first of all, if Mary, when she had that dizzy spell and she sat down, if she had simply touched the crown, she would have got a capture of her heart's activity right at that time. That would have been extremely valuable for Dr. Jones. In fact, he probably would have sent her right to the hospital for a pacemaker right from the first time she went into the office. Because remember, Mary just about died. She got up that night, she went for a pee, her heart gave out, and she ended up in very, very, very sick situation. So this could have indeed prevented that had she been wearing the watch. So it does that. Now, it doesn't quite do the same thing. It's not a 12-lead ECG. This is, you'll see the doctor here this is a hospital-generated ECG, and if you look on her phone, this is an Apple Watch generated ECG. So they're not exactly the same. But what we really want to monitor is your heart going too slow, or is your heart going too fast? The past, present, and future stuff we're going to leave for the doctors and hospitals, but for sure, we want to know if you have atrial fibrillation, and we all want to know for sure if you have a very slow heartbeat. And again, this is just a vision so that you can see that the Apple Watch is meant to be used with the iPhone. And the ECG, and so what you would see if you were wearing an Apple Watch and you had atrial fibrillation, you would see it would tell you right on the phone, right on your watch, that this ECG shows signs of atrial fibrillation. So it does a very good job of monitoring you for two very common things that happen, and one is atrial fibrillation and the other is a very slow heartbeat, which you would need a pacemaker. Now, someone asked me earlier tonight about healthcare plans, and this is an older slide, so this may have changed, but many of the healthcare services in the United States have recognized the value of the Apple Watch, and they have actually paid this. They will subsidize or pay for it. And these are the some of the healthcare plans. So if you have any of these third-party these plans, and there may be more. I don't know. This was when I made the slide. This is the ones that I found. These companies will subsidize your purchase of an Apple Watch. So I've talked a lot about Apple Watches, but not to be outdone. Samsung is coming up second, and they have a watch that's out now, and this is called the Active 2. And this does atrial fibrillation detection and monitoring, and this is an Android phone, an Android watch that will pair with any Android phone. So this is not the Apple one, but this is where we're going. The problem that we have with all these devices and why Apple is so far ahead is because each country has to certify each device for this to work. So for example, this watch has been out for 8 months and it's waiting. It's the atrial fibrillation part of this watch is not turned on yet because the FDA is not given approval for this in the United States. It's been approved in Southeast Asia, and we're told that this will likely occur in the next couple of months, and they will turn on the software for atrial fibrillation detection, and this will be my next watch personally that I'm going to have. So this will be, and there's some other watches. Now, I want to talk a little bit about, we talked earlier about AliveCor, and the AliveCor was a company founded by Dr. Albert, and he was the one that pioneered the software that is able to diagnose the atrial fibrillation in the Apple Watch. And but they've come up with a different concept here, and I just wanted to share this with you. This is a device in which it's not related to a watch. This is a device in which it's about this. It's a very small device. You put your 2 fingers on it, and it will tell you if you have atrial fibrillation and do an ECG. And I'm just going to show you a little video on how this works. So just watch this video. There's no sound with this, so we'll just watch this as we play. Actually, I think there might. Just hold on a sec. I think it will be some sound here. So just hold on. This is so this is available. That little device is available for $99 on Amazon. Now this is called the AliveCor's portable EKG. I have one. I got it at Best Buy. Usually when I give this presentation, it used to be I gave it in person to clubs. I can remember one club, I said, anyone want an ECG after I gave the talk, and there were 30 people came up and lined up. Out of the 30 people, we picked up 4 atrial fibrillation. One fella said he was feeling dizzy and had a pulse of 38. We bundled him up in an ambulance and sent him off to the hospital. And these were just people watching my show and listening to my talk. And, you know, my gosh. So this is common. This is really common. Anyway, This device is, so if you don't have an Apple, if you're not an Apple person, you don't have an iPhone, and you don't have an Apple Watch, but you are having some problems and you're a bit dizzy or you're having some difficulty, this device is only $99. You saw how simple it was to use, and it will tell you as well what your heart rate is, if it's too far, too slow, or too fast, and it will tell you if you have atrial fibrillation. And this is $99, and this was from, again, and this is from the original AliveCor work. So this is a very very interesting device. And again, this is the ECG, and this is exactly what, this is actually my ECG, and this was from the AliveCor, that device, that, and this is what it looked like. And again, it gives you an instant analysis. It reads it and says it was normal. Now, AliveCor did something else. You obviously understand the problems associated with this. We have a lot of different physical devices like the Apple Watch. We've got Samsung's Active 2 and many more coming down the channel, Fitbits. And the problem is going to be getting them all licensed in different countries. We've got all these countries, we've got all these devices, and we've got to try and get them approved in all these countries. And that's one of the reasons why Apple's so far ahead, is they've done that. So AliveCor has come up with a different approach. They can take the information from all the devices, any watch, any device you have, any Fitbit, any Samsung, any Apple, any device you have that you wear on your wrist that records your pulse. AliveCor has an app that you simply called the Cardiogram App, and you download the app onto your smartphone, and your smartphone will record it and send the information. Does not matter what device you have, but they will send it to, and AliveCor will monitor through the app, will monitor your pulse, and tell you if you have any problems. Now, this is my monitoring, and I just wanted to show you. This was July 1st last year, and if you look here, you'll see that around 6 a.m., sorry, about 6:30, you'll see this big spike here, this real big orange, and it went on for about an hour and a half, and then it sort of went back to my normal pattern. And so why at about 6:30 in the morning for an hour and a half did my heart rate go up like that? Well, AliveCor sent me an emergency notification saying, you know, hey, what's going on here? Because something was wrong. However, I was just playing golf. I was out walking around the golf course for 90 minutes. I like to walk and I was playing golf, and there was nothing wrong. The reason my heart rate was up because I was playing golf, but they didn't know that. And so it could have been, I could have been having shortness of breath or chest pain or problems. So this is a service that is, they have probably just over 1 million people. They monitor through artificial intelligence, and this app sends the data right to AliveCor, and they monitor this, and they will get back to you or your health insurance plan. You can put your information of who you deal with in this, and you can and have it directly sent. And I think the cost is about $3 a month. It's pretty darn cheap, and they do a very good job at that. And and this is what the fella in the beginning of the show, I talked to you about the fella that went to the hospital and had got saved because he came in early. He was being monitored by AliveCor, and that's what, and they sent him to the hospital. So this is the service that did save one life, at least that I know of. Now, the Holy Grail, I'm going to give you a stock tip, all right? I'm going to give everybody a stock tip so you can make some money. And I'm going to tell you that the Holy Grail of wearable technology will be in diabetes. And this is where the really big money is going to be. And it was this year, in January of 2020, which the researchers at the Samsung Advanced Institute of Technology and the Massachusetts Institute of Technology came up with the actual reproducible way of measuring your blood sugar without poking you. And this is measuring it through bloodless glucose monitoring. And they can do this by using a machine called a Raman spectroscopy. Now that's a big word to swallow, but you'll see the machine here, and this is a machine that will measure your blood sugar without being poked. It's bloodless blood sugar. And this is the holy grail. And you can bet your bottom dollar that every company, Samsung, Apple, and Fitbit, have all their research scientists working to make this device small enough to put in a watch. And when that happens, that company will be very, very, very wealthy and will change how diabetes is managed in the world today. So just let you know, and my money is betting on Apple now, and I think they're going to do it. I thought the new Apple Watch coming out would have it. Rumor is they can do it, but it hasn't happened yet. But anyway, that's just a stock tip. So in closing, I wanted to talk about two things and refresh your memory. Remember, two common medical conditions at your age. One will be a slow heartbeat, which may require a pacemaker. The other is a rapid heartbeat called atrial fibrillation. Just to refresh your memory, these both occur at age 60 and they go up exponentially. If you look here at the graph, you're going to look at that graph. So if you are above the age of 60, you stand a very good chance of sometime in the future requiring a pacemaker. And you don't want to be driving down the highway with your family when you get a dizzy spell. So that's not good. You don't want to get a stroke. And again, let's look at this. Age 60, and as you go up exponentially, that's the incidence of atrial fibrillation. So you want to find out if you have atrial fibrillation, and you want to find out and a lot of times you don't know. And that's why, again, monitoring your pulse, if your pulse is too fast, that would be atrial fibrillation. But if you're wearing one of the devices, it's going to tell you. So again, we're going to talk more about this in part 2, other things that Mary can do, Internet of Things devices that she can use, and we'll be getting into that in part 2. Now, one of the times I gave this presentation, one of the people watching said, you know, Doc, you should have the slogan, an apple a day keeps the doctor away. And I thought that was a pretty good one. So I put that in my talk, and I'm going to stop sharing now and answer any questions that you might have. Now, I can't, Lee, can you see everybody? I can't see everybody on my screen. So if you wave your hand or speak up, unmute, I just don't quite know how you want to do that, but I'm certainly open to any questions. Mark, I can see Mark's hands up there. Mark, unmute yourself and Mark, you're muted. Hit the space bar or
Okay, I should be okay now.
Yeah, you're fine now.
Thank you. Sorry. Many of us here are insured through, as seniors with Medicare, through Kaiser. Any idea if Kaiser is going to be furnishing or subsidizing purchases of these devices in the future? Do you happen to know?
I have no idea. I have absolutely no idea. I would, I mean, if other insurance companies are doing it, it would be worth asking. Certainly it's to them, it's a lot. I mean, if they can save a stroke, it's huge advantage to them. I mean, it's not that much money to buy these devices. And I think that you'd have to ask them. I honestly, I don't know.
Thank you.
Maurice?
Yeah, what's the normal pulse rate for someone our age? Is if it's low, it's an indication of probably cardiac problems. What's the normal pulse rate for someone our age, 60 and above?
Yeah, and I think that really depends. That's really a question for your family physician. It's so variable. It depends on. It could depend on medication you're taking. Some medication slows your heart rate down. It could be dependent on a lot of different factors. So I can't tell you. It's not a cut and dry. It's not 80 or it's not 89 or but certainly if you're over 120 as in the upper level, that's most likely atrial fibrillation. And certainly if your pulse is around, and you should get to know your own pulse. I mean, that's the other thing that's nice about once you start wearing these devices, you'll soon find out what your average pulse is. And if your average pulse is, let's say it's around 76 or something, and all of a sudden you get a dizzy spell and your pulse goes down to 52, then that's a very significant change and probably indicates pacemaker failure. I mean, that would be for sure if you came into my office and you said, gee, I've been watching my pulse and my pulse is always around 60 or 70 or whatever, and all of a sudden you say, I got dizzy and I went down to 50, that's a very significant drop, right? And so you have to say, why did that occur? And the most likely cause of that would be that failure of circuit breaker number 1, and that would be a problem. Yes.
Yeah, may I follow up? I normally monitor my pulse on my Samsung phone, and it's typically in the mid 80s. And I thought that probably was too high. But my brother Derek, who is here, I think he sent me something about blood pressure. There's a watch you can buy on Amazon for like $58, and it monitors your blood pressure on a regular basis. I don't remember what make it is. Any idea?
Well, yeah. I'm actually going to do a whole. The Samsung Active 2 has just come out with they're going to be able to monitor your blood pressure. This is a big deal now, and it's going to have the software. You have to be extreme. The only watch today that will accurately measure your blood pressure is a watch that's about $400, and it actually has a bladder inside the wrist, and it actually pumps your wrist up and actually does it like a regular blood pressure machine. Any other devices, these ones for $35, $50, bogus, all bogus, okay? All bogus. So they don't
Thank you.
They don't work. They do not work. The new one will be the Samsung Active 2, and this is a new technology they have, and it's based on pulse waveforms, and I'm gonna do a whole video on that because it's just coming out, okay? But do not use any of those $30, $40 watches that say they monitor your blood pressure. They don't.
Thank you. I'll yield so others can ask questions. I have one more, but I'll ask later. Go ahead, please.
All right, Janet.
I have a Fitbit, an old one, and sometimes I watch the pulse, and sometimes it doesn't show anything for maybe 30 seconds. It's just blank. It won't show a pulse. And then sometimes it'll be 176 after that. Should I worry that there's something wrong, or is it making up for when it couldn't get one for a while?
Well, that's a good question. I mean, I certainly would sort of check with your doctor and see what your doctor has to say on that.
I'm having a test next week.
Yeah, I mean, it's sort of, that's an unusual situation if it's an old watch. One of my problems, I have a Fitbit, but the quality of Fitbits just isn't that great as far as my opinion. They don't last a long time, and they need to be replaced. So I'm not sure. That's a difficult one. You want to make sure it's not just the watch, but it's important to get that checked out. Anybody else?
Yes, Maurice again. You can give the name of that company at MIT that came up with the bloodless glucose monitor. You just said MIT, and that Apple is ahead of them. Is there a name of the company?
The company.
You're gonna wait till it's green.
It was Samsung Advanced Institute of Technology, or SATE, and the Massachusetts Institute of Technology. So no company has actually patented it. I don't think they've patented this. It's MIT and SATE that both have done the research on this.
Okay.
So So I think they probably would send the data out to different companies to see, because the value of this is really being able to miniaturize the discovery.
Okay. One of my students just graduated from MIT with a degree in chemical engineering. I can check with him and see what, if he knows about this work.
Yeah, this is non-invasive blood glucose monitoring, and the paper was presented as in Science Advances at a conference in January of this year.
That is revolutionary. That's really revolutionary.
Oh, it is huge. I mean, you know how much money is spent on glucose monitoring, with the glucometers, all the stuff that we use to prick your finger, and it costs probably $500 to $1,000 a year for a diabetic just to take their own blood sugars. This is revolutionary. This is going to make this device, whoever can put this into a watch, it's going to make the device. It will, every diabetic will have one. And I think it's going to be Apple, and that'll just make Apple more valuable than it already is. For sure.
Thank you, Doctor.
Okay. Lee, can you see the other screens? I can't see the others.
Yeah, do you see a little arrow on the side of your screen?
Yeah.
You can click on that arrow and it'll show the next screen.
Yeah. So I'm looking around. I'm seeing, does anybody speak up if you have? Yes. Elliot? Mrs. Silverstein,
what's your picture?
Yeah. Can I ask my question now? Oh, here.
Yeah,
If they find out that you have atrial fibrillation, what happens next? What do they do about it?
Oh, the treatment of atrial fibrillation. Well, there are many different treatments to atrial fibrillation, and there's certainly medication that you can take. But one of the big treatments is thinning your blood out so you don't have a stroke. One of the problems with atrial fibrillation is that top two chambers in the atrium, the top two chamber in the heart, don't contract. So they just sit there and they're quivering. And so that allows for clots to occur in the top two chambers of the heart. And then these clots spin out and go up into your brain and cause stroke. So what we usually do if people have atrial fibrillation is we anticoagulate you, so we thin the blood out to prevent the stroke from happening. That's the big thing that we want to do, is we want to prevent the stroke from happening, and we can do that quite effectively with medication by thinning your blood out. Okay. Now there are specific treatments for atrial fibrillation. This gets much more technical in tonight's talk, but there are many treatments, and there are surgical treatments, there's medical treatments, there's pills you can take. That gets into a whole other ball of wax, but the essential idea is that by thinning the blood out, then you would prevent, you're going to prevent the stroke, because nobody wants a stroke, particularly if you're all doing well, you're enjoying life, you don't really want to have a stroke.
I wouldn't think so. No.
And Dr. Brown, you did indicate that the Cardiogram app, you can download it onto your cell phones.
Yes.
Is that correct?
Yes, and it comes in. It's also iOS or Android.
Okay, excellent.
And it will pair with pretty much any device. It does Garmin. It does Fitbit. It does Samsung Watch, and it'll even do an Apple Watch. And it will send the data to AliveCor. AliveCor's company has a big computer, and they've got artificial intelligence. They've been doing this a long time, and so they constantly monitor your data, right? So that and so they monitor that, and they will send the information. So if you developed a problem, then they would either notify you, or you have the option to have them notify your family physician or your physician, whatever physician you have, or whatever healthcare service you have.
I'm with Kaiser also, so Mark, you're on the ball.
Yes.
I have a question.
Yes, go ahead.
About where does they consider the low pulse rate threshold? I'm 88 years old.
You know, again, that depends. It depends because a lot of times medication can slow your heart rate down. I think it would depend. You know, a lot would depend. If you're going along and your heart rate is 60 to 70 and you're doing great, then that's fine. And all of a sudden it drops down to 45 and you don't feel well. Well, that's significant, right? So
Yes.
that's significant. So the problem is that, like Mary, when Mary felt dizzy,
Helen, mute yourself. Helen, mute yourself.
when Mary felt dizzy and she sat down, what I was trying to portray was that her heart rate was really slow then, but it only occurred for a very short period of time, and then she felt fine and she got moving again, right? So the problems that occur are often intermittent and very short, and so it's like electrical problems in your car. It's always hard to diagnose, right? Yes, who's next?
If nobody wants to go, I can go again.
Well, I think Alan's got a question. Alan Greenberg?
Alan Karagosian,
Is that?
next to you, under me.
Alan?
Okay, Paula wants to go after me, I guess. So I have a drawer full of Fitbit Surges, and I have a watch now that's supposedly also is monitor these various things. And I have one on the way. I think it's called an Asta watch, which I ordered about 2 or 3 months ago. They heavily did a advertising on the internet, and they're finally catching up, I guess, to their orders. But the big problem I have with all these watches is the Bluetooth. The Bluetooth, after a while, they stop communicating. I have a relatively new Samsung S10 phone, and they just stop giving any communication with the app. And so you have to dig into the watch to see what's going on, but it doesn't, of course, the watch doesn't retain any history. So to me, what's your experience with that? I mean, it's the Bluetooth that I find to be the weakest link.
Yeah, and I agree 100%. Bluetooth to me is a black art. You know, I think it's a weird situation. I think that, and there are also different versions of Bluetooth. So the problem ends up a lot of times with new phones and old watches is they have incompatible Bluetooth versions, and so it's a bit of a mess. I think probably Apple, because they have only one phone and one watch, they can do it a little bit better. I know my wife's Fitbit would not pair with the phone. It just wouldn't do it. The Bluetooth would never work. And when in fact I talked to Fitbit, they said, oh yeah, they looked up the model and they said, no, it won't work with your phone. And it was a Bluetooth incompatibility issue. So Alan, you're entirely right. Bluetooth is a problem, but each version of Bluetooth, I suppose, that's coming out is better. I don't seem to have as much problem in the last year as I have in the past. I have Bluetooth earphones. I have a lot of Bluetooth devices, and I haven't had as much problem in the last year as I have in the past, but I have had a lot of problems, and you're right.
I find that usually it'll work for a while. So it can't be an incompatibility problem because it does work, and then it just stops working.
Yeah.
And so another question is sort of parallel to this is there any other way? Any other manufacturing figuring out how to connect the phone to like your smartphone other than Bluetooth?
No, it's all done through Bluetooth. Yeah. It's all done. It's all done.
Mm. Okay.
Now you could ask the question. Now, one of the questions you could ask is, why do you have to have it attached to your phone? And right now, and there's lots of discussion around this, in that can't they make a device that's phone only and you don't have to actually have it paired to your phone and have it as a watch device only. And I suspect that's probably going to occur down the road because the technology is there that this doesn't have to be paired to your phone. It could all be done in the watch. I would imagine that Apple just likes selling watches. So, you know, so I suspect that's the reason. But to me, it should be a standalone technology, and I don't see any reason why you couldn't do that. So, and that would get around the Bluetooth issue.
Yeah, I would think that would make sense. Mhm.
One
Yes.
more question.
Sure.
You know, Mark and I have discussions from time to time, and Mark is always correct. We measuring the pH of your blood and making sure that it's slightly alkaline. Is there any technology that can routinely monitor the pH of your blood, and what are the implications as to what happens if your pH is off?
Well, we certainly do. The technology is there to monitor the pH of your blood. We do that in the intensive care unit all the time. We can do continual pH monitoring, but your body does a very good job in measuring your pH. Your body regulates that very closely, and it is not possible for you to change the pH in your blood. Your body will correct that, and if you did, you know, if I gave you a whole bunch of potassium intravenously to change that, you know, you could certainly die. So, so your body does a very good job of pH monitoring, and we never really monitor that as an outpatient. That's something we do in the intensive care unit.
I see. Okay.
Yeah.
Sure.
Maureen?
Yes, thanks, Doc.
Newton
7.4.
Newton has his hand playing. Newton, do you want to unmute yourself? Newton, you have to unmute yourself. Hit the space bar on your computer.
Okay.
There you go.
Okay. As an old line tech and ex-engineer and all that, what I suspect with the Bluetooth is you got a small battery in your device, and after so many charges and discharges, it's going bad, is my guess. You know, those things are only good for about maybe 1,000 charges or discharges.
Yep. Probably. Yep. I know my Fitbits, they only last 2 or 3 years, and
Yeah,
then
that's probably your problem right
yeah,
there,
you're
I
probably
suspect.
right. Yeah, probably right.
Mhm. Well, that was,
I think Mark was going to say something.
No.
Mark, were you going to say something?
No, he's out on the beach enjoying himself.
Okay, can
No,
I guess.
Dr. Brung, you started talking about accelerators, and this
Right,
friend
that's going to
of
be in
mine
part
from
2.
UCLA
Yeah.
in part 2. But can
That's
you
going to be in part
can you
2.
give us like an introduction as to?
Right. Well,
Go ahead.
So the other thing that the Apple Watch has done this very well is that it has an accelerometer in the watch, and so one of the things Apple has done, as with other companies, but Apple has done it very well, is knowing when you fall. And so what happens with the Apple Watch is if you fall, the Apple Watch knows that you fell and will come on, and you have to indicate to the watch if you're safe or not. And if you're not, then it will call somebody and get you help. But the problem is, of course, if you sit down or you stumble or you just do something that's not actually a fall, is that really an emergency situation? And Apple has figured this out very well. They spent years trying to perfect the algorithm to try and detect if you actually fall. And so these watches now are actually very good at detecting a fall. And so that's what an accelerometer is. And
It won't pick you up. No arms come out to pick you up, right?
right, but it's very, very good. And it had Mary been wearing the watch when she fell in the bathroom, then the watch would have needed. She has 30 seconds to do it, and the watch would beep, and she'd have 30 seconds to give an indication if she needed help or not. If she did not respond, then an emergency notification would go out. So, so that's how it works.
Okay, I have a question.
Yes.
One last question. Hypothetical question. Wait, am I on? Yeah. I have a pacemaker, okay? So
Right.
when I go to the hospital, the doctor, and I get checked, they connect me with their wireless, with their system, right?
Right.
So if sometimes you hear that the system gets hacked, so hypothetically speaking, I could get hacked if somebody got in it and they got on me, right?
No.
Probably not. It's not. That's probably not going to happen. It
No,
doesn't.
it's probably not going to happen, but it's a possibility. I'm not worried, but I'm just saying it's kind of funny. It could be.
Yeah.
Right?
Now, the other thing is a lot of people who have pacemakers have their pacemakers are wireless, like they're connected all the time. So there's constant monitoring going back to the cardiac center.
Yeah,
So that may also be, because a lot of questions I get asked, should I get an Apple Watch? I have a pacemaker, right? So again, a lot of times the pacemaker is monitoring all this for you. So it's not, that's not really needed.
No, I'm not worried. I even forget that I have that thing. No
Right.
problem.
That's right. Yes, Helen. Helen, you'll have to unmute yourself.
Yes, my daughter bought an oximeter because she's worried about the virus, and she thought having an oximeter, then she could check herself. What is your opinion of that?
Well, I mean, oximeters are quite simple. I mean, in fact, they've been around a long time, and they do accurately measure the oxygen in your blood. I guess if you're sick and you have a fever and you have shortness of breath, I'm not sure that an oximeter is going to tell you, you should go to the hospital no matter what. And that's something that, so I'm not quite sure if you're totally healthy without a fever, I don't see much point in using an oximeter. I don't think what happens with the COVID virus, of course, is that it gets into your airways and attacks the lining of the lungs, and particularly the tubes that go down into the lungs, and creates a lot of secretions. And it's these secretions that get forced down into the bottom parts of the lung, into the what we call the alveoli, and plug them all up. And sometimes what causes the inflammation, in some people it's really bad, and others not so bad. We don't know, but the ones that die and require ventilation are the ones that have the really quite severe inflammation.
Thank you.
Janet.
I've heard about a gadget that will diagnose if you have sleep apnea. Do you know anything about those?
Oh yeah. In fact, the whole new Apple Watch coming out does a whole thing on sleep apnea and measuring your sleep. And sleep apnea is a huge industry, and certainly I have a CPAP machine, and all the guys I golf with all have CPAP machines. I mean, it's a common condition, right? So it's not that difficult to diagnose, and certainly if you are having problems, it will. But this is what a lot of the new watches are doing, sleep analysis and trying to come up with that. But it's pretty easy to diagnose, and your doctor will help you with that. I'm not sure really the big value in it. I mean, if you're having symptoms, get checked out by your doctor, and they'll do some tests and figure it out. I'm not really sure what the point of the watch doing this is. Yes, Jen?
I'd like to know without having another overnight sleep test.
Yeah, I know. Those are a bit of a hassle, yeah. I mean, you talk to your doctor. I mean, if you wear it overnight, is it going to be accurate enough to make the diagnosis? I don't know. I don't know how they feel about that.
Oh, that was good.
Yeah, but please measure your. It is important that you watch for that slow pulse. I mean, you've all seen in the news some seniors being driving down the road, they suddenly veer off and drive into a restaurant and kill a bunch of people. And that's probably exactly what happened. is they had pacemaker failure, and boom, they become unconscious, and bad things happen. So if you do feel dizzy, you should try and wear one of these devices to monitor your heart, so you can tell if it's too slow or too fast, and for what we've just discussed tonight. All right, well, that's great. I will thank you for having me. Stay tuned for part 2.
No, thank you very much, Ron. We learned a lot tonight. And we will watch for 2.
All right. Thank you. Good night, everyone. And I will, I'll send you a copy of the recording.
Oh, that was a good program. Very good program.
All right.
What part 2? Or is it next time?
That's next time.
Okay, Ron, you send me a copy of the recording, and then I can send it to our whole group.
Yeah. Now, do you want me to sign out of the meeting now, because that means everybody's going to be gone, or do you want to continue on with the meeting and you can sign out?
No, I don't think anybody have anything else they want to discuss or anything.
Maurice,
No.
Okay.
pH 7.4.
Mark,
Then
I'm not talking to you anymore. Mark, I'm not talking to you anymore. I've ended our friendship.
All right. So I'm going to end the meeting then. All right, Lee?
Okay, well, thank you very much.